Everybody, welcome to my YouTube channel, Homoeopathy Super Sessions by Dr. Jargos. Today, I'll be doing the fifth part of one-sided disease of an external kind, that is the mental disease. So, in this video, I'll be telling you certain contributions of Hahnemann, what he did and how he treated the mental disease or mental patients. And I'm sure it will be quite useful and informative for you. So now let us say something about our great master, Dr. Hahnemann, and how he used to treat the mental disease. This is a slightly deviation from the organon textbook, because in the part 6, I'll be dealing with whatever is given in the organon textbook. I feel this is important because I feel that in most of the colleges, you may not have, they must not have taught you regarding what I have to say today. So this will help you to understand exactly how Dr. Hahnemann treated mental disease and what hardships he had to undergo in order to treat them. So let us see. So Hahnemann had paid special attention to psychiatry. During those days, practically no mental specialists were present. The method of treatment was completely different from the one usually adopted at that time. So, as you all know, during Hahnemann's time, very less importance was given to psychiatry, and Hahnemann paved the way for psychiatry by treating people with mental diseases, and he treated them in the most humane manner as compared to the usual treatment which was adopted by the old school, which was chaining them, giving them, beating them, or giving lashes to them, or giving a diet hunger for many days without food, and so on. So as you can see, this sort of treatment was very inhuman, and the person became worse from the mental disease. When Dr. Hahnemann stepped in, all this treatment was stopped, and he gave the human touch to the mental disease, and he cured quite a number of people suffering from mental disease in a very human way. So his first luck or his first breakthrough of the mental disease was by treating Cochlein-Berg of his illness. Thus, Dr. Hahnemann could cure the mental patients where other doctors had failed. So during the old school, most of the doctors, they had failed because the treatment was very inhuman. The patient became worse, and no sort of relief was there from the mental disorder. So when Dr. Hahnemann stepped in, he could definitely bring about a radical cure, and he got great fame and name because of that. Dr. Hahnemann demanded a great fee to treat such patients. So after treating Cochlein-Berg of his insanity, he became very famous. And so Dr. Hahnemann now started basically taking a fee to treat the patient. As you all know, in his life history of Hahnemann, he had gone through great hardships. He was traveling from one place to another place. He had a very large family. He had to support the family, and at times also he had no money. So now Dr. Hahnemann decided that it's enough time, or rather it is time now to charge the patients, because he was giving a good results. As a result of which, the opponents, that is the old school physician, they became very jealous, because Dr. Hahnemann's fees were much more than his opponent's fees, or the old school of physician. So this causes opponents to rage a violent attack on Dr. Hahnemann. So Dr. Hahnemann arrived at Gotha in the spring of 1792. Even Dr. Hahnemann used to charge a fee without seeing the patient. If the patient was at a very long distance, he used to write letters to them, and the patient used to reply to those letters, and then he used to prescribe the medicine, provided the patient paid his fee, whatever Dr. Hahnemann demanded. So this also became, you could say, the physicians became jealous of the old school by saying that only through letters, without seeing the patient, Dr. Hahnemann is charging the fees. The Prince of Gotha, Duke Ernest von Schazen, was well aware about the difficult times which Dr. Hahnemann had undergone. So he came to Dr. Hahnemann's assistant by allowing him to treat Coughlin-Bring of a very serious mental illness of insanity. So the Prince of Gotha, Duke Ernest von Schazen, had a soft corner for Hahnemann because he knew what Dr. Hahnemann had undergone. So he became generous. A part of his kingdom he donated to Dr. Hahnemann, and he said that you can convert this small part of my kingdom into a hospital and you can treat the mental patients. So his first patient was Coughlin-Bring, and he treated him successfully of his insanity. For this, he allowed a part of his castle on Georenthal to be converted into a nursing home for mental patients. However, this resulted in a complete failure, as it was difficult to get other mental patients in Georenthal for treatment due to the financial reasons. Maybe this place was very far, so to transfer the patient from one place to another, it wasn't possible, and it cost a great lot of money. So it, however, became a complete failure. Thus, Coughlin-Bring remained the only patient in Georenthal. So he was the only patient who Dr. Hahnemann treated successfully in Georenthal. Coughlin-Bring was cured of his insanity in the most humane way in a short period of time. So what was given? 25 grains of tartar emetic was used to treat him on account of his gluttony, to which he became addicted under Hahnemann's treatment. So Hahnemann had given tartar emetic because of his gluttony. Gluttony meaning what? Desire to eat, and eat. Dr. Hahnemann's treatment of mental patients entirely departed from the customary treatment at that time. As I told you, Dr. Hahnemann gave the humane touch to treat mental patients. So therefore, you could see a radical change in the treatment of the mental patients. Dr. Hahnemann said that he followed a completely new method of treatment. He never allowed any insane person to be punished by blows or other painful ways of treatment. So other painful ways of treatment was what? Either by starving them, or by chaining them, or by hitting them, giving slashes by cane, etc. Even no punishment was given to patients for their involuntary actions. So whatever the patients were doing, they were unaware what they were doing. So at times they used to be aggressive, they used to shout, they used to curse. So whatever involuntary actions they were doing, no punishment was given to them by Dr. Hahnemann. Thus, these patients required pity, as they were made always worse by such raw treatment. So Dr. Hahnemann said that these patients required only pity because they were made worse by such monstrous treatment. Rough treatment includes tying up the patient with ropes. Therefore, such unhappy people should be treated with respect so as to increase their confidence, and they would never feel insulted. So basically, these mental people, they were having this rough treatment, as a result of which they felt insulted day in and day out. So Dr. Hahnemann said that these unhappy people should be treated with respect so that you could boost their confidence. Dr. Hahnemann used to shower friendliness with humanity, which are combined with firmness. So he used to treat the patient in a friendly manner, in a humane manner, but at the same time, he was very firm. After Coughlin-Bring was cured, there was no more mental patients coming. Thus, Dr. Hahnemann was forced to give up the institution at Georenthal in summer of 1793. Dr. Hahnemann then saw patients at different places. In 1796 at Brunswick, 1798 at Kloinsglatter, 1800 at Altonia and Mollin in Laurenburg. Afterwards, however, Hahnemann did not treat any more mental patients. The last case he undertook was that of Wessel, and he found by experience that home treatment was not suitable for all cases of insanity. Dr. Hahnemann treated other patients by letters, beginning at Georenthal, which I've told you. It was evident by a series of letters still in existence. His prescription consisted chiefly of advice to their modes of life and diet. So his prescriptions were mostly consisted of advice to modify their life and dietary and dietary methods also, in addition to give the simillimum. With the closing of Gogrenthal home, Hahnemann found himself homeless once more. He contentedly changed his place of dwelling in central Germany. As a physician, he never remained long enough in one place to become acquainted with the inhabitants and gain their confidence. So he was constantly on the move to find out more ways of income, because as a result of which, what happened, he never became acquainted with the inhabitants of the place, and he never used to gain the confidence of the inhabitants because of his constant movement from one place to the other. Wherever he went, Dr. Hahnemann met with disappointment. He could not find a resting place in which he could keep his family and also give him the opportunity for the intellectual work, which was one of the necessity of his life. Also, the circumstances were not good, as there was a revolution in France with Russia and the old German Empire. Thus, Hahnemann once again cried out for help. So as you could see in his whole life history, it was a struggle, struggle, and struggle. So with reference to mental disease also, he went from one place to the another, to the another, to the another, in search of patients and in order to support his family. So therefore, once again, Dr. Hahnemann cried out for help. So that's all of what I want to tell you about this. I'm sure you must not have heard this also, so it will become more informative and you'll understand the concept of mental disease much more better. So in part 6, I'll be describing the 4 types of mental diseases with their treatment. Thank you so much.